In this video, I'm going to share the Medicare costs for 2026 to help you understand your options between Medicare Advantage and Original Medicare because cost is a driving factor. And these are the things I'm also sharing with our financial advisor clients who want to understand how do you help your clients prepare for retirement. So again, let's go through these costs so you can make the right decision and also budget accordingly for the upcoming calendar year. I'm Emily with the Medicare Coach, an independent Medicare consultant, helping our clients easily navigate both all the insurance company options, but more importantly, the fundamental Medicare rules to help you do what's right for you when it comes to your health care in the future. Medicare can be fantastic health insurance if you do what's right and best for you. So I'm here to help you get those inside tips to get, again, the most out of your Medicare while protecting your retirement savings. I will also share some extra resources down below to make your life simple and easy when it comes to Medicare. So Medicare costs in 2026. What can you expect to pay? Where are the changes? What are all the details we're talking to with our financial advisors? So the first thing is, and I'm going to kind of just start with Medicare from the top down. The first part of Medicare is Medicare Part A, which is mainly your hospital coverage. Most of you will pay $0 a month for that monthly premium because you or your spouse have 40 quarters or 10 years of your FICA credits, okay? So Medicare Part A doesn't have a cost for most of you. Now, Medicare Part B does have a cost. This is what this is what covers most of our healthcare, our doctor's visits, our lab tests, our durable medical equipment, our physical therapy. Medicare Part B covers most of what we use when it comes to our healthcare. In 2026, the monthly premium for Medicare Part B is $202.90 a month. Now, if you have a higher income, which means if your income from 2024 was over $109,000 filing as an individual or $218,000 filing as a couple, you will pay more for Medicare. I have other videos talking about kind of those high income penalties, but I'm going to kind of talk about the base premiums in this video. And if you want to if you have that high income penalty, you'll just have to add on those extra costs as well. Okay. So again, Medicare Part B for most of you is $202.90 a month for 2026. Now, at this point in time, you have a decision to make, okay? You're either going to stay on Original Medicare, where you will have a Part D plan as well as a Medicare supplement plan, or you will join Medicare Advantage. So I say that because I just want to be clear. If you join an Advantage plan, you still must have your Medicare A and B. You must still pay your Medicare Part B premiums. Now, if you're on Medicaid, maybe they're going to cover your Part B premiums for you. But for most of you, you're going to pay that Medicare Part B premium no matter which path you go down. Let's begin on the Original Medicare side. If you're on the Original Medicare side, again, you're going to have Medicare Part A, which is likely nothing, Medicare Part B, which is likely $202.90. You will then have a Medicare Part D drug plan because most prescriptions that you get or that you take in general are not covered by Medicare Part A or B. Now, Medicare Part D plans tend to range between $0 a month, yes, they can be free plans, up to around $150 a month. It could be higher if you have a lot of medications. The average Part D plan for 2026 is around $40 a month. Now, when I look at our clients, our average premium is probably closer to $15 a month. Again, it could be higher if you have expensive medications that have to have a higher premium to cover those medications, but most of you are going to pay not that much for your Medicare Part D drug monthly premium. Now, Medicare Part D plans, though, do have extra cost around your medication copays. So if you only take generics, your copays are probably going to be pretty close to zero. But if you have expensive things like inhalers, brand name medication, other things of that nature, it could get more expensive. Now, the good news is that Medicare has a medication copay cap for a calendar year. And for 2026, that medication copay cap is $2,100. What does that mean? It means as long as your medications that you take are covered underneath the plan's covered medication or their formulary, you will not pay more than $2,100 for those medication copays. We do have clients who hit those copays in January and they pay nothing else the rest of the calendar year for their medications. It's not a great place to be, but it's way better than in the past when your medication costs could be so much higher. So when we think about costs for Part D, we have to think about both the premium for the Part D plan, but also those medication copays, as those could be a factor. One more reminder, if your medication is not on the formulary or not approved by the plan, the $2,100 cap does not apply. For example, we have clients who are on GLPs like an Ozempic or a Mounjaro. Medicare Part D covers those plans, at least as of now, for if you're a diabetic, possibly soon for sleep apnea for medications like that. But if you are on one of those things for simply weight loss, at this point in time, Medicare Part D plans are not going to cover them. And therefore, you'll have to pay for those medications out of your own pocket, and it will not go towards your $2,100 cap. So Medicare Part D, those are the costs. Additionally, when you're on original Medicare, you will also have a Medicare supplement, sometimes called a Medigap plan. These plans range depending on which plan you pick, your state, things of that nature. But in most cases, we are estimating that you'll be to pay between $50 a month and $250 a month for your Medicare supplement plan. Now, yes, those plans also have other out-of-pocket costs, anywhere from $300 a year to maybe $3,000 a year, sometimes somewhere in between. But my point is that the premiums as well as the out-of-pockets need to be taken into account, at least in my opinion, when we're thinking about overall costs. So when we're on original Medicare, in most cases, and we get more specific with our exact clients, we look at their plans, their companies, all the things. But when we're talking to advisors, we're saying, we should probably have clients on original Medicare budget around $350 a month for their plans, plus any medication copays. So that comes out to around $4,200 a year plus copays. And when I say $4,200 a year, I'm thinking about both their premiums and also some other out-of-pocket costs that Medicare does not cover. So again, when I'm talking to advisors, we're talking about probably $4,200 for the year for Medicare for 2026, plus medication copays. Our clients, they'll get a much more specific number when we get to know them better. So that's kind of what we're thinking about when it comes to original Medicare path. Now, on the other hand, if you go down Medicare Advantage, you will have slightly different costs. Again, you're going to have likely $0 for Medicare Part A. You will likely have $202.90 a month for Medicare Part B. And then with Medicare Advantage, you just are going to have one Medicare Advantage plan. Now, most people, not all, most people will be on a $0 Medicare Advantage plan. Now, for 2026, we are seeing that some plans, if you want a PPO, you're going to have to pay more than that for that plan. But for most of you, you're probably going to pay nothing for your Medicare Advantage monthly premium. But there are still other costs. We still have those same medication costs that can be capped at $2,100. And you will also have additional copay costs when you're on Medicare Advantage. Medicare Advantage tends to have copays for things like doctor's visits, therapy, all similar to original Medicare. But Advantage plans can have a maximum out-of-pocket cost, at least for this calendar year, of around $9,000 for in-network providers. Now, that's a slight decrease from last year from their out-of-pocket costs, but it's still, I think, a fairly large number when it comes to Medicare Advantage. Why is this important? I think this is important because when we're talking to our clients as well as advisors, we want to look at what should we be budgeting for Medicare costs. I pray that everyone is always healthy and never needs any healthcare costs. But if we're going to use Medicare for its purpose, we might have health issues. And if we're going to do a budget, we should budget probably for the what ifs in life. So for most of our clients, when you're on Medicare Advantage, we're going to budget for both your monthly premiums as well as possible out-of-pocket costs for both your medications as well as that plan. So on Advantage, you're going to have, again, $202.90 a month for Medicare Part B in most cases. You're going to have an out-of-pocket anywhere usually between $5,000 and $9,000 a year. And then you're also going to have your medication copay costs. So for most of our clients, when we're thinking about budgeting for Medicare on Advantage, the budget will be between around $7,000 and $12,000 for the year. So when we think about overall asset allocation or cash allocation to a budget, Medicare Advantage does have a much higher risk cost when it comes to your expenses. Yes, it can be lower if you're healthy, which is great, but if you're not, Advantage will usually be much more expensive than, say, the original Medicare route. So when we think about costs, those are what we're thinking about: premiums, out-of-pockets, caps, copays, all of those things. So I hope this helps provide some insight around the cost for each path. Again, you're either going to pay more in premiums on the front end and less on the back end when you have health expenses, or vice versa. So it's up to you as to which one's the most important to you, but those are things to be thinking about as you're making your Medicare decision. Because of Medicare's guarantee issuance rules, we can't always change them each year, and so be thoughtful when you go into your decision and understand all the costs, the premiums, the total out-of-pocket costs, everything, so you can make an informed decision that's ultimately best for you and your situation. So I'm Emily with the Medicare Coach. Thanks for being here. Make sure you follow along for more inside tips to help you easily make your right Medicare decision.